Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to bring on my guest, Dr. Marina Yuabova, and she's a family nurse practitioner and associate professor at the City University of New York. She is also the founder of Integrative Health New York and aims to restore health holistically. Her extensive training and broad experience makes her a unique medical professional with vast knowledge pertaining to functional, integrative, and alternative medicine. She is the author of The Thyroid Whisperer and offers an array of complementary and natural medical therapies at her state-of-the-art clinic, Integrative Wellness New York. And she is also available for virtual consults for those of you who don't live in New York. So thank you so much for joining us today, Dr. Marina.
Thank you for having me.
Let's go back in time and share with us why you decided to go into healthcare for a profession.
Well, I'll take you all the way back. It's when I was 15 years of age back in Russia, and I was given a couple of choices only to either I will go to school where I can teach children to become a teacher, I become a seamstress, or I can become a nurse. So I chose nursing because I was not giving any other options. And I went into the nursing program. It's a diploma program. And within 3 years, I graduated at the age of 18 and I started working in ICU. So that was my choice. I was not given too many choices, honestly.
Now, I have heard, and I don't know if that's true, that in other countries, and perhaps even in Russia, I know, for instance, even in Cuba and in the UK and in Germany, there is actually some education in terms of natural therapeutics, even within conventional training. Was that true where you went?
It was definitely was true because we really didn't have all array of medicinals as we have here. Pharmaceuticals, we didn't have that. It was very limited. We were not able to find so easily what we can find here as medication. So only the choice that was left, more or less, it's use herbals. And yes, in school we had a class how to use and which herbals for very quick fix. Of course, they never told us you do it forever and that's going to fix your problem. No, you have to use it sparingly, making right decisions to right kind of patients. Of course, you're never going to give any kind of, very slow working herbals to somebody who has a heart attack. That's not what's going to be. And that's very important to teach. And that was one of the part where they taught us what to use and for whom and in what condition, just because we didn't have so much. We didn't have so many choices.
Wow. So I'm very impressed then. It's interesting because in Michael Moore's movie called Sicko, he actually takes a group of ill patients that are turned away from the border at the United States, and they wind up in Cuba where they are treated. And certainly there was total access to all kinds of natural therapeutics. And the point was made, like you're sharing, Dr. Marina, that the reason was more or less financial, that's what's available and costs much, much less, which is probably why in every single country across the whole entire world, in terms of America healthcare costs, it is the highest. And yet we are the 37th and way under much more disadvantaged countries in terms of health outcomes.
Absolutely, I agree with that. And of course, if you compare all different countries, if you even compare Russia to Germany, and I'll tell you, holistic medicine, it's very much advanced in Germany, much more advanced than Russia, much, much more advanced than Russia. The health outcomes are much greater than ours and all over the world, honestly, because they combine very nicely all ranges of medicine that's available. And that's why they aren't such a great advantage. Very interesting statistics analysis, and I found that even COVID death rates are, it almost non-existent in Germany. It's amazing because they're using homeopathic remedies, they're using herbals. It's just amazing. They are now nowhere there, unfortunately.
However, what we know by science is that is the best option, because natural therapeutics like the ones that you use at Integrative Wellness New York in your beautiful clinic, and I really support all our listeners to take a look at your website. It's integrativewellnessny.com. Very easy to find, integrativewellnessny.com, and you will see a picture of Dr. Marina. She's on the Who We Are page, but right on the front we see your beautiful office. It's just has such a wonderful healing feeling, and also a very upscale feeling. Like, this is not where you're going out and digging herbs like I do outside, but you're actually using many different therapeutics that have been scientifically validated in terms of their usefulness, and yet are not full of the adverse effects that would be experienced with a pharmaceutical.
That's absolutely true. And honestly, when I came across and I wanted to share a little bit of my journey, I got very ill. And really, I went from doctor to doctor, and they couldn't tell me what was wrong with me. And it took a while to even understand what was going on. And I was already by then a nurse practitioner. I was practicing medicine in a hospital. And for me, I'm practicing medicine. I know everything that I learned, and I still can figure out what's going on with me. I'm going to specialists, and people can't figure out what's wrong with me. This is what made me think outside of the box. Let's come back to the roots. Let's look what else is going on, what I'm not seeing. And all of this research, all of this searching actually brought me to this kind of medicine. So I came across to herbals. It's amazing how herbals work. Of course, you need to know how to utilize the herbs to get these vitamins and minerals, but it's actually a great medicine. And it really doesn't, there are no such a harsh side effects. We really don't have much. And I always, when I work with my patients, I teach them how to take a supplement. And if you, for example, experience A, B, C, D, and F, what you do, so all of this will come down, you recoup, and then you slowly increase the dosage again, so it becomes therapeutic. That in order for anything to work, it has to be at therapeutic range. So herbs are just like that. The difference is of how much of that herb this individual can tolerate without having a side effect. If patients are very weak, we always start them at the lowest dose. If you're thinking, how antibiotics work. Antibiotics work great if you use them properly, right? So when they have an average weight, we give them an adult dose, correct? So these people will have side effects because they are in such a frail state of health. They can't tolerate this medication at that dose. So with herbs, it's very different. You can start it very low. You can slowly come up. When it becomes therapeutic, even if they have a little side effect, you come down and then slowly taper up again and keep it in therapeutic range until it needs to be changed. So what I love with herbals, the way to get most out of it, you don't keep the same. Yes, of course, it's not an antibiotic. It's an herb. You take it for a certain period of time to get a peak level of help for the system, and then you exchange for another one, and you circulate. You can have 5-8 different herbs or different formulations of herbs, and you circulate them. And if you finish cycle number 1 and use 4 different herbs, second cycle, you can come back to the same herb and do exactly the same thing until you peel all the levels of the cabbage of the problem or physical problem of the patient until you get to the core of issue.
That's an excellent explanation. Now, of course, you are certified board certified in family health. you are board certified in functional medicine as well. So you have done an amazing array of trainings across the board. Now, I imagine since you are actually licensed to also prescribe regular pharmaceutical medications when needed, that you might actually be using them as well, but appropriately, not as the only and first intervention.
Absolutely. And that's what I gear towards. We always see how we can strengthen the system of the patient that comes to us for help naturally as much as possible. If there is an issue, and I see it with patients with chronic diseases, with patients who have Lyme's disease, chronic Lyme. So when they need a little more, I give them prescription medication for a short period of time. And then I taper them off of it.
I think that is the best integrative approach available. And I'd like to remind our listeners that you are listening to Herbally Yours on the voice of Nassau Community College 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and my guest today is Marina Yuabova. I hope I'm saying your name right. You can help us with that.
No, it's fine.
But Dr. Marina can be found at her beautiful website at Integrative Wellness NY.com. All one word, Integrative Wellness. And also, Dr. Marina, you are an author of a beautiful book called The Thyroid Whisperer.
Yes, I am. And actually, it took me a while to work on that book, and I did my best. So the goal was to explain to reader, a basic reader, doesn't have to be a doctor or a nurse, just a basic reader, to explain of the function of the entire system. Yes, I called it a thyroid whisperer because in order to regulate the function of thyroid, you have to regulate everything. And this is what people don't understand. They think if they're going to endocrinologist, endocrinologists give them a little Synthroid, they're going to be cured. It's not true because
first of all, let me interject here. Dr. Marina, what I see all the time, and I've been doing this since 1964, believe it or not, is that most conventional physicians, even if someone's a little out of whack, they might do just a level of something called TSH. Which is called thyroid stimulating hormone. And if that comes out normal, they're said, nope, it's not your thyroid. Why is that incorrect information?
Well, it is incorrect information because it's only one marker that could be used, and it's really not very effective in the diagnosis of thyroid irregularities. Well, I guess
because it's not even a thyroid hormone, as a matter of fact.
It's a hormone of pituitary gland. Yes, it's not the thyroid hormone. Basically, what they're checking is they're checking of what is signaling from pituitary to the thyroid itself to release certain hormones, such as T3, T4, free T3, free T4. It's a lot of different markers. So what I see lately, actually 5 past years, that TSH lots of times is absolutely normal. But when you look at every other marker, they are abnormal. And that's why these poor patients, they go to their primary care, they go to endocrinologists and say, well, doctor said it was okay. Well, it's not okay. If patients are not feeling well, then something is wrong, and that needs to be researched. We need to look deeper. We need to understand what's the problem. Just looking at TSH, it really doesn't give a full picture of what's going on with the thyroid function. Simply doesn't. It just doesn't. It's not correct. So the way I do it when patients come to me, and of course, in order for me to understand what their issues are, it's a lots of questions. It's an examination. I do different type of examinations, not like simple history and physical. It takes about an hour and 20 minutes to complete with one patient. So I want to understand, is it an issue of pituitary gland malfunction? Because sometimes pituitary just doesn't connect to the rest of the body. It doesn't give proper amount of signaling. So TSH could be normal because it's coming from pituitary, where T3 and T4, free T3, free T4 are suboptimal. Basically, they are low.
So you would test all of those if you suspected.
All of those. Absolutely. Otherwise, you're never going to get anywhere. I mean, you're not going to make people feel better.
Once you find, and I bet you find, we did in our clinic with Dr. Serafina Corsello, where I was a head nurse for actually 23 years, and she was very interested in balancing hormones and thyroid. And when she did deeper testing, she often did find that there were lots of issues. And then she used to actually give real thyroid hormone, sometimes just temporarily, to help take the stress off the thyroid gland, especially if there was inflammation like thyroiditis. What do you do as a next step?
So it always depends on what condition these people come with, and what their physical conditions, how do they feel, how frail they are. It's very important to understand where can you start and where do you gear them towards. So I can give you a very simple example. If a healthy female, more or less, she thinks she's healthy, she doesn't have any chronic issues that are suffering with anxiety, and she's overly fatigued for the last 3 to 4 years. I mean, this is it's a basic patient that comes to me, more or less. And also she has some hair loss. She went to a few doctors here and there, and they said everything was okay. So she got frustrated. She finally came to us. So we do our testing. I need to see where she's at. If I do blood work and I do all my testing and I see that her thyroid levels are suboptimal, meaning low, there are a few different things I can do to regulate them. It's first step. It depends how low those are. You can do nutraceuticals that have selenium, iodine, zinc to support function of thyroid, if that's appropriate for her, to help her thyroid work normally or regulate them so she has this energy, stop her hair loss. For some people, the problem is so far gone. So now she needs a thyroid replacement. And most of the time, I never give Synthroid alone, never. Because Synthroid is T4, which is non-active thyroid hormone. So in order for Synthroid to work, it has to go through digestive tract, through liver, to gut, has to activate before it becomes active in a cell. So it can enter the cell. So even if somebody gives to patients Synthroid, which I don't give just by itself, patients never get any kind of benefit out of it because it doesn't enter the cell. It doesn't do the job. In order for anything to do the job, you have to deliver it properly. So what I do, I give them combination T3 and T4. We used to have WP thyroid, Nature Thyroid. By the way, those have been removed from the market because
wait a minute, I did not know that. They have removed those natural...
Yes.
I didn't know that.
Well, this is very recent. They have removed them from the market because they were suboptimal. Meaning if they would yield on packaging 50 micrograms when they retested them, they were much below, like 35 micrograms. So if you think you want to give 50 micrograms to your patients and you're giving that dose, it never becomes optimal. So people don't have a proper effect of it. So they have removed it. I'm sure they're going to put them back when everything is fixed and when the doses is optimum again. So for meanwhile, if I don't have W thyroid or available or Nature Thyroid available, what I do, I actually write 2 prescription to patients for pharmacy. I write Synthroid, proper dosing, and T3. So they have both. They have T4, T3 that takes the part of Nature Thyroid. If Nature Thyroid is not available, you have to find something else to give.
That's right. And see, that's where it's so excellent if someone's in your care, because you are fully licensed to also prescribe a prescription medication when necessary. And you
Absolutely.
know how to do it correctly. That's really exciting.
Absolutely. And I love what I do, and I love what the results I get for my patients. Of course, sicker the patient, longer it takes. So I gave you an example of somebody who's not very ill, right? Somebody very simple. You can do A, B, C, D, and F, and she's great, and she's on her merry way. Let's say I have somebody more challenging, for example. Somebody who has chronic condition for a long period of time, can't get out of it, is not feeling great, and then it becomes a puzzle. Where do you start? So more challenging patients I really don't stimulate them in the beginning. So thyroid hormone is stimulatory. When it stimulates, it actually stresses out adrenals. And adrenals are already stressed because these patients they're long-term chronic ill patients, so their adrenals are already done. They're basically in chronic fatigue. Giving them a little thyroid in the beginning, you're going to stress their adrenals even more. So I reverse everything. So what I do, first I start with support of the system. I don't detox them. I support system first, strengthen their adrenal glands. I can give them nutraceuticals again, vitamins, minerals. I can give
Okay,
them...
wait.
Yeah.
Give us an example of some of those that you might use in a situation like that to strengthen someone.
Well, if somebody, for example, has an adrenal fatigue, right, and I really want to support them first, I will support them with minerals like magnesium, like selenium, like calcium gluconate. So even if these patients, if their gut is done, most of these people, they have already leaky gut syndrome for a long period of time. So I find a way to deliver these nutraceuticals, avoiding their digestive tract. And that goes in effect. They could use Epsom salt bath every day. And again, the temperature of Epsom salt bath, it has to be stressed, because some patients, you make it too hot, and these patients just melt. They get very tired. They can't get out of bath. So,
wow, I've never heard that before. I love doing this. I'm always learning new things. I never heard that. So that if someone's using the Epsom salt bath and it's too hot, then they feel very tired when they get out of the bath.
Absolutely. All of this goes in effect, because these people are so stressed. You give them a little bit more and heat, it vasodilates and they become very tired. It's very difficult to get out. So for these patients, not even a bath, a foot soak. So they do foot bath.
So you're individualizing that therapeutic so that someone like that who's in a very weakened condition might start with an Epsom salts foot bath rather than a full body bath. That's a very unique information.
No, absolutely. Everyone who comes, they're absolutely unique. There is no one formula that works for everybody. Absolutely not. This is a different kind of medicine that has to be catered to the individual need. This is not such a thing. You can't. It simply won't work. When we have one formula and apply to everybody, for example, I am certain height and weight, you're a different height and weight. Certain dress size is good for me. It's not good for you. The same as shoe size. So true. I just mentioned, my mom, who's 91, I actually went and yelled at a health provider because they gave her a medication, which she's actually on 0 medications now, but at that time, they gave her the exact same medication and the exact same dose as someone who was in the bed right across from her. This was in the hospital. She's 90 years old and weighs 80 pounds. This guy was 50 years old, a male who weighed 250 pounds. They were given the exact same drug regimen, and I had a fit. And that's so inappropriate. It is very inappropriate. And as teaching faculty in university, and we teach to all of our nursing students that somebody who is much older should almost use pediatric dose. And you know that because the excretion of medication is not all in the same rate. The liver doesn't work the same, so kidneys don't work the same.
Right.
So you don't start with such a humongous dose.
But they just have these protocols. That's one of the things I'm so against in conventional medicine, which coming to see you at Integrative Wellness New York .com. You go there to find out about Dr. Marina. You're going to get an individualized program, not a one-size-fits-all, which is what the protocols are in conventional medicine, because for one thing, each provider is allowed to see the patient 8 minutes if you're lucky.
Well, we provide very different kind of care, and I'm sure you know that because you worked in different practices. The initial consultation usually takes an hour 20 minutes. It all depends on what kind of patients that's coming, of course, and this is just the first appointment. I mean, it takes much more digging to understand what's going on with the system, and then when all results come back, and again, it's going to take some time to put the protocol together for that individual. I mean, nobody ever is on the same formula that come to me. Nobody. It doesn't work like that. It just doesn't.
So you individualize the therapeutic plan, but you certainly might talk about, stress reduction, very specific diets, I imagine, which is different for different people.
Absolutely.
And like you're talking about, yes, you might use therapeutic baths. And I know your clinic offers lots of other services, such as IV vitamins and minerals.
Absolutely. So it all depends on what kind of patient comes, of course, and how fast they want to see changes. So if they want to see changes yesterday, it's usually for those people who fed up and they want things happen now. IV vitamin therapy is offered. So why do we offer it? Number one, because it's 100% absorption due to avoidance of the liver and digestive tract. As we know, if you're taking a vitamin through oral route, right, orally to swallow, when it goes through digestive tract, hydrochloric acid plus the liver, it will destroy part of what you have taken. So we lose about 70% of nutrient that we take orally. And lots of patients now, and it's like it's a pandemic now, they have leaky gut syndrome. So I ask them lots of questions to understand how their system works and do very specific diagnostic testing while I am with them in a room. It's not even a blood work yet to understand what's going on. It's autonomic response testing or muscle testing, some people call it. So that's very important. We get 100% absorption with intravenous delivery, which have great abilities to improve immune system. We add all needed nutrients to patients. And again, patients are different. It boosts energy levels for those who need to boost energy levels. For those who are depressed, it's all different array of vitamins, minerals that are delivered through intravenous system.
Well, Dr. Marina, I just want to cut in here because we don't have too much time left. I just want to say how exciting it is that your center is available for patients, and for those who are not in the area, you can set up a protocol for them, at a distance. And I want to have a shout out to our mutual friend, Alex Lubarsky, because that's how I actually came to meet you. I know that you're part of the program that he teaches or puts together on the science of human optimization.
Yes,
so
he is.
How has that been for you? The science of human optimization, and all of our listeners can look that up as well.
Well, when I started working with Alex Lubarsky, who became a personal friend, and actually he was my patient first, he became my friend. It's very exciting. And he asked me to become a teaching faculty for human optimization, because obviously, mainly what we do here is optimizing a human being. Right? It's to make it work better so people can feel better, so they can function better, so they can enjoy their life, not, being in bed all day long and not being able to live their life to fullest. So now it's challenging times for everybody because now it's a COVID era, as you can understand, and patients are very reluctant of leaving their homes. They're very anxious. So we started webinars, and it has been quite effective. It's very interesting. We get a lot of people find us through the webinars, and they come to the clinic. So that has moved us in different direction a little bit, because we can't meet face to face with patients as it used to be. Like Alex used to put these beautiful events together. That's not out as yet, but we're still able to reach out to patients through webinars, and that has been effective. And of course, if somebody knows how to use computer a little bit, they can join and hear all this information that's offered to them and delivered to them.
Well, we have to end for today, Dr. Marina, but thank you so much for being our guest. And people can find you. Best place to find you is integrativewellnessny.com.
Thank you very much, Ellen.
And thank you, listeners, so much for tuning in to Herbally Yours once again, produced in the studios of 90.3 WHPC or nearby, Nassau Community College, Garden City, New York. You can also find us on iHeartRadio. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.